Hello everyone. So today I am here with a new topic, that is respiration. That is a topic from the Vital Signs unit number 7. Now what is respiration? So respiration is an process of bringing oxygen to the body tissues and removing carbon dioxide from it. So it is a process where the oxygen is been removed and the oxygen is been gone and carbon dioxide is been removed from the tissues of the body. Now the lungs plays a major role in this process. So here what organ or which is the organ that is playing a major role in this process, or the thing that is happening inside the body tissues, that is the exchange of the gas, that is oxygen as well as the carbon dioxide. Now respiration is the act of breathing which refers to two processes, that is internal respiration and external respiration. Now, here, what respiration includes, that is inhalation and exhalation. Inhalation means breathing in, and exhalation means breathing out. Respiration. So, as we see, respiration is the act of breathing, also known as ventilation. So, that is act of breathing, that is inhalation and exhalation, both process. Now, inhalation or inspiration refers to the intake of air into the lungs. So, here, what is inhalation or inspiration? That means air that is being taken inside the lungs is known as inhalation, and expiration or exhalation is referred to the term by breathing out or moving out some of the gases from the lungs to the atmosphere. Okay, from lungs the gases will pass or move out to the atmosphere. Now the mechanism of breathing. So here breathing process whereby air gases move in and out of the body. So breathing is process of moving of the gases, that is from outside to inside and inside to outside. Next, now characteristics of respiration. In that respiration rate, first it indicates the number of times the person breathes in and out in 1 minute. So respiration rate is a rate in which a person breathes out and breathes in for full 1 minute. Next, depth. It is estimated by observing the movement of the chest during inspiration, which may be deep or shallow. So here we have to do a physical examination to check the depth of the respiration. So here we can check the movement of the chest during inspiration as well as the expiration. So we have to check during inspiration that what the depth is about the chest. It is deep or shallow. Next, rhythm. It indicates the equal interval between the two respirations. So rhythm means a state in which two equal intervals between two respiration, that is one exhalation in, inspiration, and second another expiration and inspirations. Next, some terms of the respiration that are used related to the respiratory tract, that is tachypnea. First, an increased respiratory rate more than 24 breaths per minute. So tachy means increased and pnea means breathing. So there is increased respiratory rate or breathing rate that is more than 24 breaths per minute. Now bradypnea. Brady means decrease, that is a decreased respiratory rate less than 10 breaths per minute. Now, apnea. Apnea means total cessation. Ap means absence, and that is total cessation or absence of the breathing or respiratory rate. Hyperapnea. Hyperapnea means increase in the depth of the respiration. So here the depth of the respiration will be increased. Now, definition, as we learned in last slides, definition, monitoring the involuntary process of the inspiration of the oxygen and the expiration of carbon dioxide of a person. So that is a process of expiration of the oxygen and exhalation of the carbon dioxide. Respiration constitutes inspiration, expiration, and a pause. So that constitutes about inhalation, exhalation, and a pause between that two. Now, respiration is a mechanism the body uses to exchange the gases between the atmosphere and the blood, that is the external respiration and the blood and the cells. So, as we learned in last slide, it is an exchange of the gases between the atmosphere and the internal bodies. Now, purpose to determine a baseline respiratory rate for the comparison. So, it is helpful to determine some of the baseline respiratory rate and to compare it for that it is normal or not. Next, to monitor the change in the oxygenation or in respiration. So we can monitor some of the changes that takes place in the respiratory system or respiration process. So we can monitor through this. We can check about the normal or abnormal breathing rates to evaluate the patient's response to medications or treatments that affects the respiratory system. So we can evaluate whether the medications that we are giving to the patients related to the breathing or breathing difficulty, is it effective to that person, or the treatment is effective or not. So we can evaluate that. Next, equipment that are being used to do this procedure is a watch that has in second hands. Now, in procedure, first step is observe the observe the pattern, rate, rhythm, volume, and ease for effort of respiration. So we have to observe the pattern, that is the what is the rate, what is the rhythm, what volume, and what efforts are being given during the respiration process. Next, encourage the patient to place his hand over the abdomen or the chest. We have to tell the patient that he or she have to put his or her hand over the chest or the abdomen. Then the nurse should place their hand directly over patient's upper abdomen. So then the nurse will place her or his hand over the patient's abdomen, and then we have to observe the complete respiratory cycle. So after the cycle is been observed, look at the second hand in the watch and begin to count rate from 0, 1 to 3. Okay, then after observing the cycle of the respiratory, we have to start counting from 0. Now, if rhythm is irregular, count the number from respiration in 30 seconds and multiply by 2. So, within 30 seconds, if the rhythm will be normal or will be regular, then we have to multiply the count by 2. And if it is irregular, then less than 12 or greater than 20, then we have to count that for full 1 minute. Now observe for the signs of respiratory efforts, that is nasal flaring. So here in the picture you can see the nasal flaring. Then pursed lips, that is lips that have been clipped. Then use of accessories such as shoulder or the neck muscles. So we have to check for the signs that are giving and signs of the efforts during the respiration process. Then seventh, record the respiratory rate on an appropriate documentation. So we have to record the rate that we have assessed during the procedure to a file of the patient or and within a good documentation. Thank you.